51. The incubation period is the time between exposure to a pathogen and the appearance of the first symptoms. True or false? Answer: true. Rationale: the incubation period is a key phase in infection development, often used for surveillance and isolation timing. 52. Transmission-based precautions are only required for patients with respiratory infections. True or false? Answer: false. Rationale: transmission-based precautions apply to airborne, droplet, and contact routes, not just respiratory infections. 53. Disinfectants used in healthcare settings must be approved by relevant health authorities. True or false? Answer: true. Rationale: only approved disinfectants ensure effectiveness against specific pathogens and meet regulatory standards. 54. Hand sanitizers are ineffective against Clostridioides difficile spores. True or false? Answer: true. Rationale: alcohol-based hand sanitizers do not kill C. difficile spores. Handwashing with soap and water is required. 55. Standard precautions should be followed only if the patient is visibly ill. True or false? Answer: false. Rationale: standard precautions apply to all patients regardless of symptoms to prevent undetected transmission. 56. Medical asepsis involves practices that reduce the number of microorganisms. True or false? Answer: true. Rationale: medical asepsis, or clean technique, minimizes microorganism spread but does not sterilize. 57. All healthcare personnel must wear N95 respirators when entering any isolation room. True or false? Answer: false. Rationale: N95 respirators are required only for airborne precautions, such as tuberculosis or measles. 58. Isolation signs outside patient rooms help guide staff and visitors on proper precautions. True or false? Answer: true. Rationale: these signs provide critical information about PPE use and entry protocols to reduce infection risk. 59. Single-use medical devices can be cleaned and reused if properly disinfected. True or false? Answer: false. Rationale: single-use devices are not designed for reuse and may pose safety and infection control risks. 60. Gloves can replace hand hygiene if worn properly. True or false? Answer: false. Rationale: hand hygiene is required before and after glove use. Gloves can still become contaminated. 61. Surgical asepsis is also known as sterile technique. True or false? Answer: true. Rationale: surgical asepsis eliminates all microorganisms and is used during invasive procedures to prevent infection. 62. Face shields provide full respiratory protection in airborne precautions. True or false? Answer: false. Rationale: face shields protect from splashes, but do not filter airborne particles, and N95 respirators are needed for airborne precautions. 63. Contact precautions require the use of gloves and gowns. True or false? Answer: true. Rationale: gloves and gowns protect against organisms transmitted through direct or indirect contact. 64. The chain of infection includes 6 elements, and breaking any one of them can stop transmission. True or false? Answer: true. Rationale: intervening at any point in the chain, agent, reservoir, portal of exit, mode, portal of entry, or host, can prevent infection. 65. All bodily fluids are considered potentially infectious under standard precautions. True or false? Answer: true. Rationale: standard precautions treat all blood and bodily fluids, except sweat, as potentially infectious. 66. The use of PPE eliminates the need for hand hygiene. True or false? Answer: false. Rationale: hand hygiene is essential even when PPE is used, as contamination can still occur during removal. 67. The use of chlorhexidine is more effective than soap alone for surgical scrubs. True or false? Answer: true. Rationale: chlorhexidine has broad-spectrum antimicrobial activity and residual effects, making it ideal for surgical scrubs. 68. Droplet precautions require a private room and use of a surgical mask within 3 feet of the patient. True or false? Answer: true. Rationale: droplet transmission occurs via large respiratory particles, requiring a mask and distancing. 69. The removal of PPE should always begin with the mask. True or false? Answer: false. Rationale: gloves are removed first to reduce the risk of contaminating other PPE and the hands. 70. High-touch surfaces like bed rails and floor pumps need frequent disinfection. True or false? Answer: true. Rationale: high-touch surfaces harbor pathogens and require frequent cleaning to reduce transmission risk. 71. Infection control is less important in outpatient care settings. True or false? Answer: false. Rationale: infection prevention is critical in all healthcare settings to protect patients and staff. 72. Airborne infections can be transmitted over long distances via ventilation systems. True or false? Answer: true. Rationale: pathogens like TB can spread through tiny particles that remain suspended in air and travel through HVAC systems. 73. Cleaning is a form of sterilization. True or false? Answer: false. Rationale: cleaning removes visible debris but does not kill microorganisms. Sterilization is needed to eliminate all microbes. 74. PPE should be donned before entering the patient's room and doffed before exiting. True or false? Answer: true. Rationale: this minimizes contamination of clean areas and protects healthcare personnel. 75. Patients with multi-drug-resistant organisms, MDROs, should be placed under contact precautions. True or false? Answer: true. Rationale: MDROs spread via contact and require enhanced barrier precautions to prevent outbreaks. 76. Masks should be worn by patients on airborne precautions when transported. True or false? Answer: true. Rationale: this limits the spread of airborne particles during transport through hallways or shared spaces. 77. Handwashing for 10 seconds is sufficient to remove all pathogens. True or false? Answer: false. Rationale: handwashing should last at least 20 seconds to effectively remove dirt and pathogens. 78. Autoclaving is a method used to sterilize surgical instruments. True or false? Answer: true. Rationale: autoclaving uses high-pressure steam to destroy all microorganisms on instruments. 79. A sterile field remains sterile even if unattended. True or false? Answer: false. Rationale: a sterile field should not be left unattended as it may become contaminated without visual monitoring. 80. It is acceptable to recap use needles after injections. True or false? Answer: false. Rationale: recapping needles increases the risk of needle stick injuries. They should be disposed of immediately in sharps containers. 81. Infection can occur even in the absence of visible signs and symptoms. True or false? Answer: true. Rationale: asymptomatic carriers can harbor and transmit infections without showing clinical signs. 82. The incubation period is the time from exposure to the appearance of the first symptoms. True or false? Answer: true. Rationale: the incubation period refers to the interval between pathogen exposure and onset of symptoms. 83. Sterile gloves are required for routine vital sign assessments. True or false? Answer: false. Rationale: clean gloves or hand hygiene are sufficient for non-invasive procedures like vital sign assessments. 84. The use of alcohol-based hand rubs is less effective than soap and water. True or false? Answer: false. Rationale: alcohol-based hand rubs are effective in most situations unless hands are visibly soiled. 85. Fomites are living organisms that transmit infection. True or false? Answer: false. Rationale: fomites are inanimate objects that can carry infectious agents, not living organisms. 86. Healthcare workers can be sources of nosocomial infections. True or false? Answer: true. Rationale: Improper hand hygiene and lack of precautions by healthcare workers can lead to healthcare-associated infections. 87. Protective isolation is used for immunocompromised patients. True or false? Answer: true. Rationale: protective isolation prevents infection in patients with weakened immune systems by limiting exposure to pathogens. 88. The term bacteremia refers to bacteria present in the lungs. True or false? Answer: false. Rationale: bacteremia refers to bacteria in the bloodstream, not in the lungs. 89. Surgical masks filter out small airborne particles. True or false? Answer: false. Rationale: surgical masks block large droplets, but do not effectively filter small airborne particles like N95 respirators. 90. Soiled linen should be handled as little as possible and with minimal agitation. True or false? Answer: true. Rationale: minimal handling reduces the risk of airborne contamination from particles and pathogens. 91. Only patients with diagnosed infections require standard precautions. True or false? Answer: false. Rationale: standard precautions are applied universally, regardless of a patient's infection status. 92. The skin is the body's first line of defense against infection. True or false? Answer: true. Rationale: intact skin acts as a physical barrier preventing the entry of pathogens. 93. Gloves should be worn when touching intact skin. True or false? Answer: false. Rationale: gloves are not necessary for contact with intact skin unless required by isolation protocols. 94. Hand hygiene must be performed before and after using gloves. True or false? Answer: true. Rationale: gloves are not a substitute for hand hygiene, which must be done before donning and after removing gloves. 95. A sterile object is considered contaminated if it touches a non-sterile surface. True or false? Answer: true. Rationale: any contact with a non-sterile surface breaks sterility, rendering the item contaminated. 96. Cleaning instruments before disinfection or sterilization is unnecessary. True or false? Answer: false. Rationale: cleaning removes debris and is essential before disinfection or sterilization to ensure effectiveness. 97. Use of antimicrobial soap is recommended for routine handwashing. True or false? Answer: false. Rationale: plain soap is adequate for routine handwashing. Antimicrobial soap is used in specific clinical settings. 98. Tuberculosis requires the use of droplet precautions. True or false? Answer: false. Rationale: TB requires airborne precautions, not droplet, due to its transmission through fine airborne particles. 99. Isolation precautions should be based on the mode of transmission. True or false? Answer: true. Rationale: transmission-based precautions, contact, droplet, airborne, depend on how the infection spreads. 100. Patients with suspected C. difficile infection should be placed under airborne precautions. True or false? Answer: false. Rationale: C. difficile requires contact precautions and handwashing with soap and water, not airborne isolation.